Hi, I'm Dr. Kenneth DeLay. I'm a board-certified urologist practicing in West Columbia, South Carolina. I use this channel to educate my audience on issues related to urology, sexual health, health policy issues, and other life musings that come up. If you enjoy what you see, please like and subscribe and turn on notifications so that you can see future content as it is released. Kidney stones are a very common urologic disorder. They can be both painful and sometimes require procedures in order to treat them. Unfortunately for many patients, there are recurrent kidney stones and they will have many episodes over their lifetime. Patients with very frequent kidney stones need a metabolic evaluation to try to identify specific causes that can be addressed. Yet, here are some generic recommendations that can apply to most stone formers, and we're going to review those today. None of this is specific medical advice, and before changing your diet, you should discuss your health conditions with your personal physician. Patients with a history of kidney stones should have a urine volume of at least 2.5 liters per day. That sounds like a lot, and it is. And in fact, you'll have to drink more than 2.5 liters of fluid in order to have this urine volume. The reason for this is that we evaporate fluid through both our skin and respiratory system. In general, it is best to avoid consuming sugar-sweetened beverages to increase your urine output because this has actually been shown to increase the risk of kidney stone formation. Alcoholic beverages, coffee, tea, wine, and orange juice, interestingly, do not increase the risk of stone formation. In general, drinking water would be the best. Adding lemon juice to this may increase your urinary citrate, which decreases your risk of future kidney stones. The consumption of salt or sodium should be limited to 2,300 milligrams or less per day. The reason for this is that the consumption of salt increases the concentration of calcium in the urine, which increases your risk of certain types of kidney stones. If your stones have been made of oxalate, as in calcium oxalate stones, then you should consider moderating your oxalate food content. Oxalate-containing foods can easily be found online, and I'll put a link in the comments below. But oxalate-containing foods include leafy greens, chocolate, and tea. Sometimes patients will have calcium-based stones, and they think that reducing to a low-calcium diet will decrease their risk of future stones. The reason for this is complicated, but in fact, kidney stone formers should not have a low-calcium diet, as this actually increases the risk of future kidney stones. Kidney stone formers should consume between 1,000 and 1,200 milligrams of dietary calcium daily. Eating a diet rich in fruits and vegetables and limiting non-dairy animal protein helps prevent kidney stones. When you eat a lot of animal protein and few fruits and vegetables, this creates a metabolic acidosis, which increases your risk of kidney stones. Once again, these are fairly broad recommendations. If you have recurrent kidney stones, your doctor may order a 24-hour urine test called a litholeak, which along with the stone analysis can allow for an individualized plan, which may include further dietary recommendations or medications. As always, I hope this content was helpful. If it was, please like and subscribe and turn on notifications so that you can see future content as it is released.